Clinical supervision is an important component of the helping process for counselors and other helping professionals. Let's listen as counselors share their thoughts on the value of supervision.
Well, I think for one, it's an idea bank almost. You know, someone can come to you and you can share ideas with and perhaps give them different ways to see things. But a very important part of it also is just to be a good listener in that situation, because many times you're the link between that person's situation that they're in, and they just need someone to listen to them and to get feedback on their ideas, and so listening is just as important as any other role in supervision.
I've really had some questions about my own clinical judgment and needing a lot of encouragement in that area, and it's been very helpful to have supervision that addresses both the professional consultation side but also looking at the personal issues and helping to facilitate feeling more confident about my clinical judgment.
It's also really nice to, especially as a beginning counselor, to have a supervisor as a source of support. It's kind of really scary to be going in there and seeing your first client, and so to be able to go to somebody and say, hey, this is how I'm feeling, I'm pretty anxious, I'm pretty nervous, and to have someone kind of validate that and also provide support.
I've become much more creative as a counselor as a result of being in supervision. I have learned to think in very diverse ways about cases, about client situations, and about addressing the needs of my clients. And I think that's been the biggest growth component of being in supervision for me.
In the mental health setting, supervision is so important. There are so many different issues that clients present with, and so many different things going on in the clinic itself, that during supervision it's a nice time to get insights about not only your clients but about what's going on with you personally. You know, what are things that's happening during the session that maybe that I'm not aware of as a counselor at the time.
Supervision has personally been beneficial to me because I come into the first meeting and I come with my experiences, my style, my personality, and then when I sit down with the supervisor, they come with who they are. And the good news is that the differences between us enhanced my work.
In this videotape, Dr. Diane Borders and Dr. James Binshoff provide an introduction to the process of supervision and answer two questions. What is supervision? And what do supervisors do? These questions may seem basic, even simplistic. However, there's much confusion about the goals and functions of clinical supervision. This videotape offers a framework for conceptualizing the work of a supervisor that will first allow you to identify the supervisory role or roles that you naturally assume, and then will offer you some ideas for expanding what you do. Essentially, our goal is to help you think like a supervisor. Now Dr. Borders and Dr. Binshoff talk about their experiences with supervision.
When I work with people teaching them to be effective supervisors, the first thing I emphasize is that becoming an effective clinical supervisor requires learning how to think like a supervisor. And learning to think like a supervisor is related to, but it's different from, the way we're taught to think about working with clients.
Supervisors are really one of the gatekeepers of the profession. They provide additional training and support for counselors to make sure they have the necessary skills to work with clients effectively. They do the evaluations to decide if counselors are eligible for licensure and certifications that are marks of their professional development. They're also ensuring the well-being of clients. So in many ways, they are really a central part of what we do in our profession.
Clinical supervision seems particularly important to me as a way of developing the skills, the attitudes, and the thinking of counselors, whether we're beginning counselors or more advanced counselors. So even as more advanced counselors, clinical supervision plays a critical role in helping us to maintain and to continue to develop and expand our clinical skills throughout our careers.
One of the reasons I'm convinced that supervisors need training is that the activity of supervision gets confused with other activities. It gets confused with case conferencing. It gets confused with case staffing. Both of those are important activities in their own right, but supervision is a different activity with a different purpose.
Well, it's important to train supervisors because being a good counselor is not good enough. Supervision is not the same thing as counseling. Clinical supervision has its own models, its own techniques, its own issues, and its own interventions that overlap with but are not the same as those we encounter in working with clients. And the purposes of supervision are somewhat different from the purposes in counseling.
It is important to clarify what supervision is and to identify some basic principles of supervision. According to Bernard and Goodyear, clinical supervision is an intervention provided by a more senior member of a profession to a more junior member or members of that same profession. This relationship is evaluative, extends over time, and has the simultaneous purposes of enhancing the professional functioning of the more junior persons, monitoring the quality of professional services offered to the clients, and serving as a gatekeeper of those who are to enter the profession. Dr. Binshoff expanded on the goals and functions of supervision in a workshop for clinicians. In this segment, he will present his list of supervision maxims. As you listen, try to identify the key cognitive shift that helps a counselor think like a supervisor.
The fundamental purpose, though, of counseling supervision, from my perspective, is the further development of the supervisee. So the primary focus in supervision is on the supervisee. The client is the vehicle for learning. Okay? Provides the opportunities, the stimulus for learning. Okay? And as a supervisor, I have a responsibility to make sure the client gets adequate, at least adequate care. Okay? But my primary focus is not on the client most of the time. It's on the supervisee. Okay, which is my first supervision maxim. And I didn't make all these things up, but as I said back in November, I kind of, in a faculty meeting one day that was a little slow, I kind of created a list of things that I thought were key things for me about what supervision was about. And the first one is the one that I was just mentioning, is that supervision is first and foremost about developing a supervisee's skills, knowledge, and ability to deal with clients, now and in the future. Okay. Supervision also is a developmental process. It's related to counseling, but it's distinct from counseling. It's a helping relationship, much like counseling, but it's not the same thing. I mentioned the third one. A client is a vehicle for enhancing the development of the supervisee. I particularly like the idea that supervision is a two-way learning process, that the supervisor and the supervisee can learn from each other. I certainly find that true as a supervisor, and if it were not true, I think I would have moved on to something else a long time ago, because I'd be bored doing the same thing over and over again. And I'm constantly learning from my supervisees. Sometimes I feel like I learn more from them than they may be learning from me. I usually don't disclose that to them, though. Sometimes I do. My supervision when I worked in community agency the model was heavily around case conferencing. You know, we came in once a week and I presented a difficult case, and the consulting psychologist, who was very good at this, actually facilitated some discussion and some thinking about it, and then she often prescribed some things that she thought I ought to do. And my experience is that that is a very common method of providing supervision, and there's nothing terribly wrong with that, except it is very limited, and it's only one aspect or one approach to providing supervision. Often, I think it's the only one we get, if we get any supervision at all, because it's efficient, but pretty limited. Number 3 here is that you can be both supervisor and supervisee. That's the essence of peer consultation or peer supervision, that we can take turns, that I'm not, because it's a lifelong need and opportunity, I don't move beyond needing supervision, and so I can be supervising others and be getting supervision myself at the same time and be learning from both of those processes. The last one on this overhead is supervision is not about cloning. It's not about creating more people who work with clients just exactly the way that I do, who believe the same things, who do the same kind of interventions. Rather, I'm trying to work with people to help develop their potential to do it however they do it. Okay? So when I first start with my supervisees, I ask them about which theoretical models they like, how would they describe what they do as a counselor, what's the process look like for them, and I try to get an understanding of what they do, and then I also do some disclosure. Okay, well, here's where I'm coming from, here's what I do, I'm not real psychodynamic, I do these kinds of things, and if they're completely the opposite, I'm still going to try to work with them to do what they do better, even though I'm also going to try to share some of my ideas with them. So it's a mutual learning process here.
Dr. Binshoff makes the emphasis of clinical supervision clear. Clinical supervision is an educational process with a shift from focusing on the client to focusing on the supervisee. Clearly, the highest priority of a supervisor is the well-being of the client and ensuring that no harm comes to the client. Beyond this, however, the focus is on the professional development of the counselor, the learning goals and needs of the counselor versus the goals of the client. When one is thinking like a supervisor, the more critical questions are about how to help the counselor meet the client's needs. The supervisor asks, what skills does the counselor need to be effective with this client? What is the counselor's conceptualization of this client, and how might that be broadened or sharpened? Are there personal issues that seem to be hindering the counselor's work with this client? Based on this assessment of the counselor, the clinical supervisor asks, how do I create a learning environment that addresses this counselor's needs? Supervision, then, is a planned educational experience. It involves short-term and long-term goals for the counselor's development. It is intentional and it is proactive. How does the supervisor plan for supervision? In the next portion of this videotape, Dr. Borders demonstrates the use of the discrimination model as a framework for thinking about the roles and functions of a supervisor.
When a supervisor is thinking like a supervisor, how does the supervisor plan for a session? The discrimination model created by our colleague, Dr. Janine Bernard, gives us a very useful framework for doing that. The discrimination model has a lot of practical value, as those of us that have tried to use it know that, and it has a lot of empirical support also. According to the discrimination model, there are 3 roles that a supervisor can take on based on the goals of the session, the assessment of the supervisee. Those 3 roles are teacher, counselor, and consultant. Now, it's important to realize that the supervisor doesn't become teacher, become counselor, become consultant so much as the supervisor draws on the skills from each of those roles. Janine also identified 3 focus areas that the supervisor can give attention to. Counseling performance skills refers to what the counselor is doing in a session, the behaviors, the skills the counselor is using. Cognitive counseling skills refers to how the counselor is thinking about a client. Self-awareness, or being aware of the beliefs, attitudes, reactions to clients that counselors have during sessions and between sessions. Another colleague, Dr. Wayne Lanning, added a 4th category, professional behaviors. This category refers to ethical and legal situations that may come up in counseling and need to be discussed in supervision sessions, or other areas related to one's functioning in a particular counseling setting. Let's look at how the discrimination model works, how it really comes alive during supervision sessions, starting with the teacher role. From the teacher role, the supervisor may instruct or teach a new skill, confrontation skills, paradoxical interventions, positive reframing, or a technique such as the 2-chair technique in Gestalt approaches to counseling. Or the supervisor in the teacher role may help a counselor better conceptualize a client. How does a family history of substance abuse influence a client's current behavior, for example?
The supervisor also may give some additional information or new information to a counselor about an ethical standard or a legal issue that helps the counselor know how to behave appropriately in a particular situation. From the teacher role then, the supervisor is imparting new knowledge or helping a counselor learn a new skill. You can see that this role seems to be particularly salient when we're working with beginning counselors. The second role of the supervisor is counselor. Now, from the counselor role, the supervisor is helping a counselor with self-exploration about beliefs, attitudes about counseling, reactions to particular clients. For instance, you have a counselor who's working with a client who challenges the counselor a lot. What you might do as a supervisor from the counselor role is work with the counselor to identify their feelings of defensiveness in response to the client's challenges and become more aware of those and what those mean to the counselor. Or you might reframe the client's behavior as self-protection. This is a way the client has of trying to create some distance between the client and the counselor that feels safer for that client. The supervisor from the counselor role also might be helping identify what are some other skills that could be used in responding to the challenges of the client. The third role of the supervisor is that of consultant. Now, from the consultant role, we're usually responding to a counselor's request. So there's an assumption here that the supervisee has some ideas about what he or she needs from supervision. So from the consultant role, the supervisor may be helping the counselor generate ideas about other interventions that might be effective with this particular client. Or think about why this intervention. Try to understand why an intervention didn't work with a particular family. Or in an ethical situation, help generate various options that would be appropriate to use with that client. From the consultant role then, we're usually working with a more advanced supervisee. To better understand how to apply the discrimination model, let's look at some vignettes of James working with supervisees. Using the supervision matrix, let's identify the primary role and the primary focus area James has chosen to use in each session.
I'm feeling the need to be a little bit more direct or structured with a client of mine, and it's really difficult because that's really not my style.
Mm-hmm. Can you give me an example of some time when that happened to you?
Yeah, there's a young lady that I'm seeing right now that has a relationship problem, and she's staying in the relationship. And when I asked her, well, what keeps you in this relationship if you're unhappy? And she just was just going on and never really answered the question.
Mm-hmm. So how were you feeling when she was going on and on?
Well, I kind of felt like we were getting off track a little bit, and I was really wanting her to answer the question, but I didn't want to impose my style on her.
Okay. So in addition to thinking that you were getting off track, how were you feeling about what was going on then?
Well, I kind of felt like we were drifting a little bit. I kind of felt that we had gotten off track and weren't really accomplishing anything.
And what was that like for you to just drift, to feel like you were drifting?
It was unproductive, is what it was for me.
Sounds like it was also kind of uncomfortable for you. Like you were kind of didn't have anything to grab onto.
Right. Yeah, I was a little uncomfortable because we were just kind of drifting a little bit, and like you said, there was just nothing to grab onto to kind of reel her back into answering the question.
Okay. Okay.
In this vignette, James is primarily acting from the role of the counselor, and he's primarily focusing on the supervisee's self-awareness. The counselor role emphasizes here how the supervisee is feeling about what he's doing in counseling. James used several counseling skills here, reflecting, asking challenging questions, trying to help the supervisee become aware of his feelings in a particular situation. This vignette illustrates that you can use the roles not only as supervision interventions, but also as assessment. In asking these questions and continuing to ask and challenge the supervisee in this way, James is getting a lot of valuable information about his supervisee's ability or inability to focus on feelings.
I'm feeling a little frustrated with my client. I saw her yesterday, you may have seen the tape, She was talking about her relationship with her boyfriend, and then she started talking about her relationship with her mom, and she talked about some other issues that seemed to be really important to her. But she just seemed to be going around in circles and not very goal-directed, and I was wondering if I should just let her talk or what I should do.
Okay. So one thing you did on that tape was you did a real good job of getting her talking. And the problem with that is that she kept on talking. It just kind of kept wandering with it. So what you'd like to do is to kind of get her to focus a little bit more, it sounds like. When I watched the tape, I noticed that also, and remembering what you said there, you said to her something very much like, tell me about your relationship with your boyfriend, which is a real open-ended kind of statement to make to her, and she took that and kind of ran with it. And so if you wanted to get her to focus a little bit more, you might try asking her a more closed question that would kind of force her to narrow her response a bit more. It might help her to focus.
That sounds like a good idea.
Here we see James primarily functioning from the role of the teacher and primarily focusing on counseling performance skills. Notice that he gave Atisha positive feedback and gave her a specific example of what she did. This is a fairly typical example of using the teaching role with the beginning counselor. From here, James could choose to do several things from the teacher role. He could do a role play that would allow Atisha to practice skills, and then James could give her immediate feedback, or he could take the role of the counselor in a role play and model the skills that he's trying to teach her.
Did you get a chance to listen to my
Listen to your tape.
Yeah, Maura, she was quite a handful.
Sounded like it.
Oh yeah, I didn't didn't have any idea. I don't know, when I see somebody the first time, I don't necessarily have any idea of what their background is beyond just their name and so on. And so I went out to the waiting room, and this person was in a wheelchair. And so I was pretty aware as we're walking back to my office of, in my mind, going over, okay, what is, how do I fit this in? What does this mean? Thinking about being concerned about wanting to be politically correct, and and how I had addressed her and dealt with her and so on. And so we come into the office, and there's the way that my furniture is in the office is I have my chair, and then obviously the chair directly across from me is where the client sits. Well, I just invited Maura to come and wheel up next to me, kind of in between those two chairs. Well, she's continuing to talk to me, just kind of small talk. She wheels over and uses her legs in the chair to move that client chair out of the way, and then plant herself directly across from me where she knows she's supposed to be. But she moves very close to me, and it just so happens that my chair is slightly lower than her wheelchair. And so for at least the first half of the session, I'm feeling like she's talking down at me, and she's very hyper, talk very fast, and she says, well, I suppose you know why I'm here. And I said, why should I know? And she says, well, because of what I wrote down. I have its intake form that I use. And she had indicated on there some symptoms that would indicate that she has some problems with food. And she says, well, I have an eating disorder. And I said, oh. And she gave me a little history and on that, and told me she'd seen somebody last summer in Atlanta, and so on. And then, so then she starts talking about this interpersonal issue where she kind of rejected by a guy she was dating and so on. And so I start going down that road with her, and then she says, yeah, but what are we going to do about this eating disorder? So, I'm trying to figure out, I want to attend to clearly what her presenting problem was, but at the same time, I'm getting a sense that there's a lot of other things going on. This is a person who broke her back when she was 17. She's now 26. She's trying to date. And so there's a lot of pieces that I'm trying to figure out how to put together in a way that will keep her, in therapy, because I'm, kind of afraid, if I don't meet her requests, that she's going to book on me.
Okay. She's really got you kind of backed up against the wall.
Oh, yeah.
Literally and figuratively.
Yes.
Imagine her rolling in and, in your face, as you describe it almost, and kind of, looking down at you. And she's making demands of you, saying, this is what I came in for. At the same time, she's throwing out other issues. And every time you look over here, she kind of waves the eating disorder over here and calls you back. And then she moves over here, and you look there, and she waves back here.
Absolutely.
So she's really, sounds like a very challenging client to deal with.
Yeah.
Sounds like she wants to be a challenging client to deal with.
Well, yeah, I almost feel like her interpersonal style is one that she uses to kind of control the relationship, to control, the interaction. Like, as long as she's going and talking and, in control, then she's in charge, and, she has the power.
So she seems very not only comfortable with being in charge, she would be uncomfortable, you imagine, not being in charge and sharing the power with you.
I think it's possible, or there's something about it that feels like vulnerability, like that she's not wanting to be vulnerable, or does not want me to see her as vulnerable, and so she presents herself as very much in charge, and I'll sit where I know the client's supposed to sit. You don't have to make any special arrangements for me. I want to be treated just like everybody else.
Okay.
The consultant role is often the hardest to explain and to illustrate. It's most typically used with supervisees like Pat, who are advanced enough that they can come to supervision describing their process, their feelings, their reactions to clients, and have some sense of what they need from supervision. Notice how Pat talks about her feelings and reactions to her client, and even her own cognitive process during the session. James then is helping her process during supervision her thoughts about the session, helping her understand the dynamics of the client and their counseling relationship. He's really helping the counselor think through. Neither of them know exactly where they're headed in understanding or where they'll come out, what decisions may be made about how Pat will proceed with the client. From the consulting role, those goals are often less clear. The role is more to help the counselor process.
Research using the discrimination model has found that supervisors tend to have a preferred role and focus area. You may want to test yourself by taping a session and analyzing it with a colleague to determine what your preferred roles and focus areas are. The next questions then would ask how appropriate your preferred roles and focus areas are for the counselors you supervise, and how flexible you are in using other roles and working on other focus areas. This kind of activity can help a supervisor identify areas of strength and areas for growth.
There's several things for me that are fun about supervision. One is that I have to think on several levels at the same time. I have to think about the client and what the client needs. I have to think about the counselor and what the counselor needs from an educational standpoint. And then I have to think about the supervision process and pull all that together, how I need to work with this counselor in this session at this point in our relationship based on what I know about how that person learns and how that person's motivated, to be able to help that counselor do the things they need to do, make the changes they need to make, to be able to work with the client to help the client make needed changes. So I've got to be thinking in all those levels at the same time and making decisions on the spot about where to go, what to pursue, what to do at a particular moment.
I see supervision as a two-way learning process. I'm constantly learning about myself and how to work with clients from my supervisees, and I hope they're learning from me also.
The bottom line is that supervision is a planned educational experience. Supervisors, effective supervisors, are intentional and they're proactive.
From my point of view, clinical supervisors play such a critical role in counseling that as a profession, we can't afford to not prepare people to be as effective in this role as they possibly can.
I think about supervision as like a Bach fugue. There's a simple melody going on at several different levels. They come together in an elegant composition that you almost can't hear the individual strains because they are woven together so well. And for me, that's what supervision is like. Thinking at a lot of different levels, using a lot of different skills, and having to integrate them in a unique, elegant composition. And that's part of the fun and the challenge of doing supervision.
In reflecting on this videotape, there are 3 points I'd like to emphasize about supervision. One is that supervision is related to, but it's separate from counseling. Second, that being a good counselor is a prerequisite for being a good supervisor, but it's not enough. And third, that this videotape is only a first step in learning about supervision. There are many more aspects of supervision to learn about, including things like dealing with resistance, ethical and legal issues, evaluation of supervisees, the dynamics of the supervisor-supervisee relationship, and many, many more pieces to the supervision puzzle. This is just a starting piece.
Following the credits for this videotape, additional supervision vignettes are provided for use with the workbook that accompanies the videotape or for use in the classroom.